Welcome to the Healthy OC segment on Real Orange. I'm Heidi Cortese. Vaccines ensure that you and your loved ones are protected from dangerous and often deadly diseases. However, the mostly unfounded fear of side effects has spread like virus itself, undermining the effectiveness of the nation's vaccination program and putting lives in danger. Our guest, Dr. Felix Horng, will explain that vaccination is not a shot in the dark. Welcome, Dr. Horng.
Thank you for having me here.
Most of us recognize that being vaccinated as individuals is very important, but what does it mean for the community?
Well, it actually is a very important thing to be vaccinated for the community. The best example I can give is if somebody is living in a neighborhood where their house is the only one that's not fireproofed, and the rest of their neighbors are fireproofed. If a wildfire were to come in, the fact that their neighbors are fireproofed might prevent their house from burning down. And in the same way, when somebody is vaccinated, they are actually protecting the community and protecting from the spread of disease and actually protecting those that are not vaccinated.
There's been a swirl of controversy about some vaccines, specifically MMR for mumps, measles, and rubella, causing autism. What are your thoughts about that?
Well, and that fear came from a 1998 study from the British journal The Lancet, which is, by the way, a very reputable journal. In that study, there was a concern that the MMR vaccine might be causing autism. Now, the medical community always was a little skeptical about this study because the design was not a highly well-thought, well-founded study. And so there have been subsequent studies to determine whether or not there was an actual link to the MMR and autism, and nothing has been found in the years that we've looked at it. Recently, in the last year and a half, that same journal, the Lancet, withdrew their journal and said that the vaccine actually was not linked to MMR. 10 out of the 13 authors actually withdrew their statements, and it was found that the lead author, Andrew Wakefield, had some conflict of interest and had possibly falsified data.
So the whole claim was bogus.
Correct, and in fact, nothing that we have seen and looked at has shown that there's been any link between the MMR vaccine and autism.
Well, let's talk about the new vaccine we're all hearing that's being pitched like crazy to women, Gardasil, for HPV. It's now being pitched to men. What's all that about?
And this is a new recommendation now as well, and not very well known. The HPV vaccine is a vaccine that protects against cervical cancer. So why would a male get a vaccine to protect against cervical cancer? And it's that same thought that if a male were to get the HPV vaccine, they would be able to prevent spread to the females. And as a side benefit, they also protect against genital warts as well, so they get that benefit.
Thank you so much for being with us on the Healthy OC today. That's a wrap. I'm Heidi Cortese. Get all your shots. Be well.
All right, thanks so much, Heidi.
The Woodbury Medical Group is a medical practice that combines the strengths of both primary care and urgent care to the Irvine and Tustin areas. At the Woodbury Medical Group, you can make an appointment to see your favorite physician or walk in to access same-day services. Our facility has on-site x-rays, laboratory blood work, and a nearby pharmacy. Our patients tell us that they love our short wait times and easy access, but consistently they come back because of the quality of care. We've made significant investments to make sure that patients are seen on a timely basis.
Anemia is the most common disorder of the blood. There are several kinds of anemia produced by a variety of underlying causes. Dr. Felix Horng of Hoag Memorial Hospital Presbyterian in Newport Beach will explain the symptoms and the treatments for this disorder.
Anemia, the technical definition, is a reduction or deficiency in hemoglobin, which is the major molecule that transports oxygen to our body's tissue. And why that's important is because oxygen is needed by our tissues to properly function, and without oxygen, tissues can actually be destroyed. So anything that reduces the delivery of oxygen can put our tissues at significant risk. Actually, a lot of times patients don't know that they're anemic, and we find out by accident on a simple blood test. But those that are symptomatic will sometimes feel tired or fatigued, which sometimes is a problem because that's similar to other medical conditions as well. Lightheadedness or dizziness are also features of anemia, and for somebody who has severe anemia, sometimes they can find themselves short of breath or pale. Sometimes the anemia actually isn't as dangerous as the cause of the anemia. For instance, somebody who has sudden anemia might be found to have a bleeding ulcer from colon cancer. And so for those individuals, the anemia was actually a tip-off to a much more major medical problem. 3.5 million Americans have anemia, and up to 10% of all women. And so the typical patient most commonly seen are iron-deficient women. And for good reason. Women have a reason to lose blood once a month through a menstrual period. And so the typical person commonly is your average female. But anybody can be at risk for anemia, especially with the different variety of causes that we see. Most physicians will say that there are three major causes of anemia. One is from a lack of production. So somebody that may have, let's say, iron deficiency, for instance, lacks the iron that's necessary to produce red blood cells. That's a decrease in production. Another cause might be excessive blood loss. So somebody who is bleeding, or let's say a woman with heavy menstrual periods, or somebody who has chronic bleeding ulcer, has a source of bleeding, they have a loss of blood, that causes anemia. And then the third cause is usually from destruction of red blood cells. And that's typically an autoimmune disorder or a genetic disorder. And so those are the three main causes of anemia. But because of the vast, numerous number of reasons why someone can be anemic, it's, I think, surprising for some patients to understand that anemia is one of the most challenging diseases that a physician can sometimes find themselves evaluating or treating.
We asked Dr. Horng how anemia is treated.
Treatments do follow the different causes of anemia, and so yes, it can depend on whatever the cause might be. Would be how we might treat anemia. So let's say, for instance, somebody has iron deficiency. We would simply replace the iron that they're missing. If somebody was bleeding, we would correct the cause of the bleeding. And so, yes, it is important that we find the cause. That's the key to treatment for anemia.